News Radio 600, Kogo.
You know, there's a study out. This is very interesting. And if your child or children have been bullied, this is something you need to listen to. It says childhood bullying can lead to chronic disease.
Chronic disease in adulthood.
Yeah, and how? That's the question.
Taaka is joining us here on the Kogo News Live Line, a psychiatric mental health professional who specializes in child, adolescent, and adult psychiatry. And tell us, doctor, how do they correlate these two things?
Higher correlation. Good morning, guys. Thanks for having me. They're seeing a higher correlation of fight or flight response as it correlates to adulthood that is causing increased risk for cardiovascular disease, heart disease, diabetes, and also prolonged stress and strain on the body. Your body eventually exhausts out.
Okay, so how old are we talking about when it comes to kids? Are we talking about boys and girls, and what ages are we talking about?
Yes, in my clinic, I am seeing boys and girls starting out as young as 4 and 5, 6 years old. I had a kid a few weeks ago who choked out another kid. I had a kid, parents who were putting him to bed and said, hey, I want to hang myself. A child who came in over a month ago that was saying, I'm having heart palpitations. I can't breathe. I feel like, it's impending doom. Like all of these things that are happening to our kids. And what we're seeing is that not only the bullies are having issues, but the kids who are trying to protect themselves are also having problems as well.
Wow, this is a little bit stunning. If somebody's in their car right now, they're a mom or a dad. I mean, these are big. These are issues that we would generally think of as adult issues. Correct.
And so these kids can't escape it. Think of cyberbullying. They're seeing it in technology. I've had kids that I see all the time, kids and teens coming in and saying, someone is bullying me online. I didn't pass a test. They're telling me to go hang myself. They're telling me that I will never amount to anything. And then so they end up starting to defend themselves. And so that's where that bullying starts. And so your body goes into this fight or flight response. The cortisol is released, and then your body just says, I'm exhausted from all of this. So you start to have metabolic changes. You start to have hormonal changes, which affect sleep. Kids are, they're irritable when they get up in the morning. And when they go to school, they're even more irritable. And then that starts to, they start to say, hey, I'm angry. And then, I'm agitated. Then they start raging out. And then you start to see that they're behaviorally acting out.
So what's the best thing for us to do?
Education is the key. Education is the key. Educate the school. Educate the teachers. Have the teachers to assess the student that's there. A lot of these children are being misdiagnosed as attention hyperactivity kids, or kids who have inattentive disorders or mood disorders or even bipolar disorders. We don't even diagnose kids that early. And so it's just kids who are trying to protect themselves and who are really just under a lot of undue stress.
So they're basically in fight or flight mode all the time.
Correct. And so when your body is in fight or flight response all of the time, your memory center, we have cortisol receptors that are there. And then what ends up happening is that it's like having pollen on the windshield of your car. You can't see, you can't think, everything is off. And then what's left is that little emotional ball in your brain. And so they start to overestimate these emotions. And so the way that they would behaviorally respond at a level 2, they're responding at a 10 or a 15. And so that's why we're starting to see that kids are becoming bullies, and they're actually they have victims, and these victims are starting to become bullies as well. And then these teens are manifesting in my office, and then they're coming in with, physical issues as well as mental issues. And then you have the adults who are coming in with the chronic issues. And that's why we get these labs on all of these patients prior to even prescribing medications. We look at their cortisol. We look at their prolactin levels. We're looking at their cholesterol levels, because there's a correlation between how you feel and how what your mental health and well-being looks like as well.
All right, doctor, thank you very much. Dr. Taaka, who's a psychiatric mental health professional, joining us on the Kogo News Live Line.